and of which we assume erroneously that it is the only world that matters. Through their agency, we are no longer intimately connected with our world and its beings. We have put a gap, a chasm between them and us. We have separated ourselves from them. We have put, and that is a crucial point, even a tragical point in human life, if you will, this deadly estrangement between them, between the outward world, the objective world, and us. But it is necessary for mastering life, for else we would be overwhelmed by outward forces. But now we are so accustomed to the use of thinking and willing that we can no longer do without them, that we are forced to apply these tools also to our own psyche, thereby putting the same safety limit between us and our own deeper psychic processes. And that is, as we well know, the source of all, or almost all, psychic and somatic sufferings. It could be compared to an armor that prevents us from being wounded, but at the same time it prevents ourselves and others from getting across to the deeper psychic processes. Thinking and willing are the two uppermost layers in our mind that conceal the deeper layers. And we have to get rid of them in order to get to the real sources of life. So you see that in your second picture, willing, and in your third, thinking, have been eliminated, obscured. How do we do that? There are two ways leading to it, two principal ways of effectuating what we call hypnotic trance, two kinds of induction. I have here some copies of this scheme. You don't need to design it. 20 copies for those who are interested in it. The first one, in picture 2, consists, the first method of getting to hypnotic trance, consists in providing the will of the client with a task that is so monotonous and boring and outrageous that it will get blunted, as for instance, staring fixedly at a bright point. And when the will is no longer in vigor, thinking too, having lost its energetic potential, will become more and more drowsy and finally peter out entirely. Then we have hypnotic trance, and then the deeper layers of the mind have become accessible. Or on the other side, we can start, as is seen in picture 3. In picture 3, we can start from the upper left field, conscious imagining, logical thinking, and try to eliminate this by storytelling, for instance, stories, of course, not of a rational kind, rather kind of fairy tales, or by speaking in a confused, absurd, or contradictory manner, or in a symbolic or metaphorical fashion, or by using one of the different confusional techniques. Then rational thinking will become more and more discouraged, utterly discouraged, and finally being given up in pure despair. And even before, the vanishing of logical thinking will result in an elimination of the willpower as well, because it is no longer offering the will the motives it needs to become effective and to release its power. What about the circular movement of what we people call the vital impulse or libido. When there is no longer anything here in 4, picture 2, then obviously the impulse, the vital impulse will be blocked. It will be distracted in another direction. So it will dodge to the next available channel. And then this will be naturally this one, unconscious will, instinct. And so we have the opportunity to lead the vital force to a place of our own determination to become effective. Instead of becoming effective in producing outward actions, it gets transformed into an inwardly acting agent. It gets internalized. And because this section 1 is closely connected with somatic processes, e.g. all events controlled by the autonomous nervous system, we may, by feeding in appropriate suggestions, take influence on physical parameters as pulse rate, blood pressure, blood sugar, function of the intestine, and of course the hormonal and the immune systems as well. And when the third section is abolished, as in picture 3, then the vital impulse will deviate into section 4 and actualize its potential here, but it will no longer be controlled by rational thinking. It will, in a kind of way, blindly, without insight, without understanding or reflection. That is the mechanism of post-hypnotic suggestions. And you know very well that such a suggestion will prevail even without being understood by the client, by the subject. And when asked, the subject will invent all kinds of evasions, of silly excuses, of ridiculous and absurd rationalizations, invent them because there is no rational reason for his achievement. This is a clear demonstration that section 3 has been put out of circuit. So we can influence not only section 1, that is instinct and bodily functions, but on the other side our willing functions as well. And these suggestions will succeed independently from any rational motive, without any intervening reflection, without any ambivalence or doubt, automatically, and therefore with a plainness and a force comparable to the power of compulsive, obsessive symptoms. The bearing of these possibilities on behavior modification is obvious. I thank you for your kind attention.
Discipline in dealing with issues such as stress, social pressures, destructive cravings, and to focus upon new opportunities for development and growth. Next slide, please. When reviewing the literature, I think it's important to mention John Ellingson because he, at that time, it was not a popular issue in England to separate psychological approaches to medical problems. As you know, the Asian dualism was in effect, and the only person that I really know that could separate mind and body was, his name was Dr. Guillotine in France. But anyway, getting on with probably the first practitioner to really use hypnosis was Bramwell, and he used it in conventional medical practice in England. And if you ever have a chance, I would try to get that book called Hypnosis and Treatment by Suggestion, and present some cases on drink and drugs. And it's a very interesting piece of work. orientation. Next slide, please. As we can see, Watson Hoffer recommends not using hypnosis at all with alcoholics, and Overdorf uses hypnosis with neuro-linguistic programming, and he talks about the entire orientation for every session is geared towards proactive problem solving, emphasizing that the patient must take responsibility for setting goals. And Ernie Rossi, in a recent interview by Yapko, states that all the hypnosis journals are behind the times, and that actually the most innovative articles on hypnosis are being published by journals on neuroscience, and that they have such titles as ritualistic relaxation and lymphocyte movement, and so on. So there is a need to incorporate mind-body healing concepts in our work with hypnosis and recovering addicted patient, and for more longitudinal research in this field. Next slide, please. Okay, one of the interesting and distressing things about the addiction field is the definitions of addiction, its boundaries and parameters are very confusing, and the fine distinctions of the scientific community doesn't always measure up to what our patient's impression is about addiction. Unfortunately, we do not have a clear understanding why one person becomes an addict and others do not. Earl and Crow point out that there are certain clinical attributes that they have in common, and this is the list of attributes that they give. Low self-opinions and personal shortcomings, and they constantly remind themselves of their shortcomings, unrealistic and distorted beliefs about their behaviors, events in the external world, and about themselves. And then there's the desire to suppress unpleasant emotions, the desire to escape. There's also the difficulty in coping with stress. At least one intense memory of a high experience at a very crucial time in their life. And also they have an uncanny ability to deny that they have a problem. Next slide, please. As we know about people with addictions, that they often trade off onto other compulsive behaviors or other addictions. And these may vary from the over-the-counter medications to inhalers, to compulsive spending sprees. And one of the things that I'm finding in my neck of the woods, since Atlantic City is in close proximity, is that there's really a lot of people that are also addicted people and also have compulsive gambling problems. Next slide, please. We'd like to also mention that it's very important to revivify the emotional pain to the addict that there is they must pay attention to that, and because often structure and emotional process over time. And this is often helpful in tracing back the intergenerational relationship of addiction. Because oftentimes, as you know, there's people in the family history that have also been addicted to alcoholism and drug addiction. In terms of communicating with the recovering addict, it's important to meet them in their concept in the world. Milton Erickson said that. But I think it's also important for the therapist to remember not to remain in that world, that they must take the lead. And also, it's important to sometimes pay attention to the gateway drugs or entrance drugs that people may take, like, for example, people that are addicted to using marijuana may have started by cigarette smoking, and it progresses from there. When are drugs or compulsive behaviors used? Is it after a party with friends, or is it after a fight with a lover or spouse? And how are they anchored into the use? In other words, when do they use that? What triggers that off? Next slide, please. Okay, the day before yesterday, somebody talked about placebo effect and mind-body healing, and I think this is something that should be incorporated in treating the addict too. Suggestion is a very powerful tool, and it's important to provide the message that change is possible, desirable, and rewarding. Also, hypnosis can help in the control of psychological responses, and many of the people that are using this in treatment programs talk about this. Also, if you're going to climb a mountain, it's important to do it in legs, to break it down into small steps, and not to be overwhelmed by the size of the mountain. And sometimes people that are into addiction are overwhelmed by the size of the mountain. Also, the positive enthusiasm of the therapist is important to get the message that you can do it. Next slide, please. In our culture, and I'm sure in your culture, there's certain unrealistic expectations about hypnosis. We live in a culture in America where we want instant results, so we're looking for magic, we say. And there's all sorts of misunderstandings about hypnosis. So it's important to try to help people disclaim or to recognize that some of these things are really myths. Before you start, like I said, there's confusion about sleep and hypnosis. There's priorities. Also become obscure when there's no pain. Oftentimes, after the crisis is over, as you know, most addicts are very crisis-oriented. They want help then. And once the crisis is over, it's back to life as usual. And there's the myth that you can deal with it by, controlling the addiction. You say you can, and in fact, there's a book out on that, how to be a controlled drinker. also, like in any other type of therapy, problems with hypnosis can occur with that, and usually they're from induction or the inability to achieve mutual treatment goals with the patient. Next slide, please. Okay. In the first treatment session, it's important to develop mutually agreed goals with the patient. And it's oftentimes the spouse may have different goals than the patient, the therapist may have different goals than the spouse or the patient. So there needs to be some sort of cementing of that early in the game. And also there's two kinds of motivation. First, positive towards some better life experience, such as you know, if we do that, I'm going to have better health, I'm going to have better inner peace, that sort of thing. And then there's negative motivation, which is stimulated by maybe the loss of a lover, or the loss of a job, or rest, that sort of thing. And I would like to also mention the illusion of positive motivation. Some people come and they say, I really want to do this, and it brings to mind a lady that I saw that came to see me. I had seen her husband, and he wanted her to see me, and she went into great detail about how wonderful my husband felt we were, and so forth and so on. And her husband was a researcher. He was a very respected man. He spent time working, and she felt neglected, and consequently her unconscious motivation revealed that her addiction was her friend. And she felt that if she came for therapy and failed